What are these hyperdense structures along the diaphragm? This axial CT shows multiple hyperdense structures along the right anterior hemidiaphragm centered around the anterior to mid aspect. Here's the view on coronal CT, again showing how they are centered in a geographic area. The answer is diaphragm plication. This patient had history of prior thymic cancer with pleural deposits requiring resection and a diaphragm plication. This pre-op CT shows pleural metastases in the anterior costophrenic recess in this patient with invasive thymoma. Here's what one of the pledgets looks like. There are several repair methods, including radial and circumferential, open versus minimally invasive, and transthoracic versus transabdominal. In terms of operative indications, the goal is to improve dyspnea by reducing dysfunctional diaphragm excursion during inspiration. An individualized multidisciplinary approach is necessary to determine if patients with morbid obesity or neuromuscular disorders are appropriate candidates for diaphragm plication. Surgically, the first stitch is in the middle of the circumferential line of repair. The second stitch enfolds the redundant diaphragm in a radial line of repair, using pledgets for anchoring of the ties. Then, several interrupted stitches are usually needed to complete the line of a circumferential repair. The last image shows the radial repair. Reported complications include pneumonia, pleural effusions, abdominal compartment syndrome, abdominal viscous injury, DVTs and PEs, stroke, upper GI bleeds, arrhythmia, and myocardial infarctions. You now know a lot about diaphragm plication. Please subscribe for more awesome anatomy and radiology videos.